So parents across the country have a lot of questions whether their kids just went back or are about to go back to school. We're joined now by two pediatric infectious disease specialists, Dr. Jacqueline Wong in Hamilton and Dr. Fatima Kakkar in Montreal. Welcome to both of you. We know there's lots of Omicron out there in schools and outside. And I want to put the same question to both of you, starting with Dr. Kakkar. What would you say to a family who wonders how long their child should isolate if that child's been exposed to someone with COVID?
I know this is really confusing because the guidelines aren't the same across country and across public health jurisdictions. So what I'm going to give you are some general guiding principles, but don't be alarmed if a specific health district changes this. In general, a contact of a contact does not need to isolate. A contact of a known case, it will depend on whether it's a home setting or the school setting. So if it's a household contact, in general, they will need to isolate. If it's a contact that happened in a school setting, across most provinces right now, that child does not need to isolate. Now, there might be specific instances where it's deemed exceptionally high risk, but in general, the school setting is not considered a high-risk environment, so children won't have to isolate.
Okay, that's a pretty impressively complete answer, Dr. Wong. Anything you wanted to add to that?
Yeah, no, I would agree with that risk assessment because it has to do with what the nature of the person's contact is with that person who's a positive case in terms of, is it in a setting where they probably have a mask on and other different layers of protection? And then to the question about how long they should isolate for, it kind of depends on the environment that they're going back to. And to Dr. Kakkar's point, it can vary across the country. But we're seeing more and more jurisdictions where, if you're a contact, of a positive case, that duration of isolation is shortening. And especially if they're going back to a setting like school where you're not seeing a lot of high-risk individuals, you're seeing a bunch of healthy people, I agree that we should be shortening that risk of, that period of isolation.
I'm interested to hear what each of you are seeing in terms of kids with COVID, whether it's in hospital or not in hospital. Dr. Wong, what about in Hamilton?
Yeah, so anecdotally, and Dr. Kakkar referred to this like the last time we met, there's a lot of kind of respiratory or nasal symptoms like congestion, runny nose, sore throat. That's what I've been hearing from people who are testing positive and fortunately not needing to be admitted to hospital. Throughout this pandemic, we've been seeing relatively low numbers of admissions in our pediatric hospital. So we're talking about less than 10 a day who are admitted, sometimes less than 5. And, the minority of that would be admitted to the ICU, and those who are admitted to the wards, probably about half of them are incidentally found to have COVID, as opposed to the other half that are admitted for COVID. And usually it's fever management, hydration, and occasionally needing a little bit of oxygen support.
And Dr. Kakkar, as Dr. Wong pointed out, this is anecdotal at this point, but what are you seeing in Montreal?
Sure, no, and it's very much what we've described. So what I can say is that having been on call these last few weeks, there's way more COVID now than I've seen since the beginning of the pandemic, but the vast majority remains mild. And as Dr. Wong says, over half the kids are not actually admitted for COVID, they're just testing positive on admission. In the community, I can say that about a third of my patients have had COVID over the last few weeks. So there is widespread community COVID. But the vast majority of those children are not being hospitalized. And really right now, the most common symptoms resemble a cold, nasal congestion, sore throat, and maybe fever, which is very different from what we saw early on in the pandemic.
Last question also to both of you. Maybe you have 30 or 40 seconds to answer, and I'll start with you, Dr. Kakkar. Across the country, parents have kids who are either returning to school or have been in school for a short period of time. They might be anxious. What would you say to them?
I do want to reassure them. So I've seen so much pediatric COVID these last 2 years, and I've also seen the effects of not being in school. And really, for most children, the benefits of being in school far outweigh any potential risk from COVID. And any of that potential risk is minimized through vaccination. So I really do want to reassure parents that it is safe to start school tomorrow.
Dr. Wong?
I have to echo the same thing. We're talking about risks and benefits of different things, and kids really have struggled from not having consistent in-person schooling. So again, similar message. I can appreciate it is a bit of an uncertain time. There's a lot of change in practice happening, a lot of change in philosophy, but children belong in school. They deserve in-person schooling, and they will do well.
There's a lot of controversy on this issue, as you know, and so I appreciate your willingness to give us your advice. Thanks to both of you.
Thank you.
Pleasure.